And with that, I'm also going to share my screen. So uh, what I would like to mention to everyone is we're going to cover a couple topics today, and hopefully we'll have ample time to uh, discuss amongst ourselves what some of the finer points of those topics are. And the two topics we're going to discuss today are ones that for some of the assisters here, it's probably uh, old information. It's something that they're well acquainted with, but we are going to be discussing dental insurance and uh, how to purchase a dental insurance plan. The second thing that we're going to talk about is we're going to talk about income. And income is, again, it's a subject that uh, can get pretty complicated from time to time. So hopefully we'll be in a position where, at the end of the session, we'll have a better understanding or appreciation for both dental insurance and for how to calculate income for a customer. One of the things that I wanted to, while we were all still filing in, one of the things that I wanted to make sure that everybody was aware of is that we have officially completed phase one of our American Rescue Plan implementation, which that actually uh, you should have received a notification about it last Friday. Thursday evening into Friday morning, the resources were put in place so that we could now make sure that the Pennie application was updated with regard to the savings that are coming down by way of the American Rescue Plan for our customers, and that includes the addition of the unemployment compensation toggle, and we'll actually see that on an application here in a second. In addition to that, just keep in mind that for the redeterminations, we have a target here at Pennie, and it's going to be during that first week of June. We hope to have the redeterminations ready to go for the current customers. And, again, hopefully it'll be a time of a lot of jubilation. There are a lot of families out there right now. There are a lot of individuals who are trying their best to make a go of it and make 2021 better than 2020. And I guess the question could be big: how could it not be better than 2020? But to be quite honest with you, the savings that are coming down from the measures that President Biden put in place, they're going to impact a lot of individuals very, very positively, and it's a good time for us to be doing what we do. With that being said, I again am going to start off with a exploration of dental insurance. I just wanted to make sure that everybody was aware that uh, that the that the comparison shopping tool was updated, as well as the application in terms of the new premiums and the markets available for those premiums. When we enter Pennie, one of the first things that we see is that Pennie has health and dental plans. And a common question that Juan and I get in our outreach to different stakeholders throughout the Commonwealth of Pennsylvania, consistently, we receive questions about, well, can someone purchase health and dental, or can they just purchase health or dental on Pennie? And the answer is people can purchase health or dental. Of course, we love them to purchase health and dental, because dental health is actually an incredibly important facet of care, as many of you know. And it's one that oftentimes it goes neglected. So with that being said, I'm going to go ahead and log in as our favorite assister, Olivia Fox. So in doing that, here's Olivia's dashboard, her sister dashboard. And when we get to this sister dashboard, one of the things that we want to do is, if we want to take a look at a dental plan, we have to go to our active customers, and we have to select the customer that is making the inquiry about the dental plan. And in this case, it's Mr. Thomas, Dan Thomas. We can see here that it's just him. His family size is 1. We can see that his eligibility status is conditional. We see that his application status is, they've actually received his eligibility, which is nice. At this point, we just click on Dan's name, and it takes us through again to a summary snapshot. But again, anytime we want to work on behalf of a customer, of course, we go into the customer view. And when we click on that, we get this notification that says, hey, you're about to enter a customer's application. Do you want to proceed? And yes, we want to go into an individual view. Okay. So at this point, Olivia, and we can see Olivia is Dan Thomas's sister of choice. Okay. This is where the customer, if they really need to get in touch with you quick, they got your phone number here, they can view your profile, etc. One of the things that we hope never happens is they de-designate you as their sister. We like to, make sure that relationships stand with regard to that. One of the things that we've done ahead of time is we've created an application, and we have a couple different ways of viewing Dan's application. We can go to My Applications here, and we can see quite literally when the application was created. We get the application ID, the case ID. We have, the APTC that he's qualified for, cost sharing reductions. We know ahead of time. We can view the eligibility. If we want to, we can cancel the application here. Okay, so that's another important factor. We can, work with them on verification documents. We can also view and print the application. Okay, but for right now, the big question is, Dan Thomas, he called us and he said, you know what? I'd like to be able to, shop for dental insurance with you. So we're going to review this for Mr. Thomas, and all that we need to do is click on Shop for Plans. Okay. This is our next step in the process. We're going to be shopping for plans. He completed the application with us, and we're going to go through, and again, they asked the hardship question here. What is the hardship question? Hardships are financial situations and other circumstances that keep you from getting health insurance. If you qualify for a hardship exemption, you don't have to pay a fee for the months you were uncovered. So that's a question. That's a question that you want to have with folks, and you would answer at this point. Where we're going from here, though, is we're going to go right in and see what Mr. Thomas qualifies for by way of, financial assistance. We see that. And we also have dental plans here. It says, please complete health enrollments for all members. So in case there are any subsidy amount left over from health enrollments, it can be used for dental enrollments. What we want to do is we want to start dental shopping at this point. Okay, so we're going to shop dental plans. We want to click on that. It'll take a second here. Now, this takes you directly to shopping for the dental plans in Mr. Thomas's market. Okay, these are the dental plans that he would qualify for. An important factor to keep in mind is you can, just like any other just like any other type of insurance through Pennie health insurance, you can, separate these by PPO, HMO, EPO. You can look at low cost. You can look at, plans that, literally cover the gambit. So what we're going to do is we are going to go in. There's a plan here by DentaQuest. But one of the things that we want to do is we want to take a look at PPOs. Okay, so we'll take a look at a PPO. PPOs are nice from that vantage point. With regard to comparison, you can click here to compare that particular Delta Dental plan. Let's say we want to compare it with this Dominion plan. We can click compare. Okay, and here's a Humana plan. This is something that might be of benefit. So let's go and click on compare. So now what this does is it provides us, as a comparison, of course, it provides us with the ability to actually compare those plans. If we want to compare apples to apples, these are PPOs. If we wanted to mix it up, we could always do that as well. It's basically what is in the best interest of the customer and where the customer is guiding us in this conversation. So from here, we can look at the finer points. To be quite honest with you, with families, for families, if this were a family situation, one of the big concerns, especially with dental insurance, one of the big concerns that especially if and knock on wood, if you have dependents that are getting near that age where they may where they may need braces, knowing the level of orthodontia that you have available to you is incredibly important. So this is where you can get into, again, you can get into the finer points of these plans. So with regard to the dental plan, if we decide for Mr. Thomas, if he says, you know what, this Delta Dental plan is the plan that I think makes most sense for myself, we'd click on that, and it says here, you selected Delta Dental Basic Plan for families. Okay, well, in this case, it's an example, but this is where once you have this dental plan selected, and again, this is for demonstration purposes only. Once you have a dental plan selected for the customers that you're working with, at that point, if the application's, if the application's just there and ready to go, you can click to sign the application, which we're about to do, $13.10 a month. Okay. Before you enroll, please confirm the following. Preferred dentist participates in your selected plan. If, and a lot of people do have a preferred dentist that they work with, or even a preferred practice that they work with. And when I say practice, I mean, a larger practice that may have 3 or 4 dentists. And in some cases, depending upon the city you're in, it might be even more than that. The idea is here it's a deliberate pause in that application. It gives you an opportunity to check with the customer to see, you know what, we need to, we want to make sure that your particular dental provider is available here. If they're ready to enroll, we click ready to enroll. And from there, of course, there's the terms and conditions, Pennie agreement. And again, this is something that most of you are very familiar with. We want to make sure that, we e-sign.
Hey, Scott, before you
Yeah,
move on, can you just go
yeah.
back into the plan preview? There's a question here if you're able to see the other details in the preview tool.
Hold on one second. In the plan preview, okay. We're back in the plan preview. Hold on. There we go. And it was a question, are we able to see what?
Other details such as copays for routine care and the whatnots of dental.
Sure. If we select a dental plan, again, the last view we had, we were looking at um, 3 comparison plans, okay? But when it comes to routine dental, dental checkups, deductibles, which are important, out-of-pocket maximums, which are very important, you can see that information here. And again, when you're comparing plans, it provides you with the ability to look at the plans either apples to apples or apples to oranges. Okay, so you should have the ability to see that information, and again, it's important because for some folks, and I'll This is a very good question. And the reason that I say it's a very good question is because I'm a proponent of dental health. Okay, I really am. As many of you know, I'm a licensed producer in Pennsylvania. I don't write insurance anymore, but I there was always a question, and it was with the insurance agency that I worked with before. There was always a push on dental insurance because folks would argue whether or not dental insurance was, whether it was even relevant. And to be quite honest with you, I've always viewed dental insurance as being something that's incredibly relevant to a person's health. But there were many of my colleagues that would push back and say, by the time you take a look at the out-of-pocket maximums and the money that you put into it, you would be better off, saving your money, etc. I don't know that I necessarily agree with that. So from our perspective as sisters working with the community, being able to clearly communicate to them what their what their checkups would cost, what their deductibles would be, um, what the the adult deductible would be in some cases, out of pocket maximums, co-insurances, especially when you get into orthodontia. Okay, for children, it's incredibly important that you be able to show them that and work with them through these processes. And as much as possible, that's why the ability to go in and do a comparison is incredibly important. And again, for those of you who have worked, very, very closely with insurance over the years and you understand dental insurance plans well, I think you'll find that, just from a snapshot perspective, you'll be able to pick up on a lot of, the snapshot, the higher level snapshot things just from what you see here in the comparison tool. Beyond that, it's when either you can look into, and we'll just do this again for comparison's sake. We're going to compare two plans here. We'll go in. This is where it helps to be able to go through this comparison process and literally take a look at what the individual deductible is. Here, under Delta Dental, it's $60. Underneath Dominion, it's $100. Now, $40 might not sound like much to you, but to someone else, $40 might be, it might be a lot. So being able to work with individuals through the finer points, it's important, and that's part of the reason why we have this comparison tool set up the way we do. Okay, so going back, what we want to do is we want to take a look. We've already got this in our shopping cart. So what we want to do is we'll hit our little house here. And we're going to go back to Dan Thomas's, whoops, here we go. We'll go back to Dan Thomas's account. And here we could shop for plans. We're going to go in here. There we go. Gonna continue. There we go. Boom. Gonna shop for dental plans. It's giving me a minute here. Okay. We're gonna go ahead and add our Delta Dental. Boom, there it is. Continue to cart. So here we have our Delta Dental plan. Now we're gonna go through and sign the application. Ready to enroll. So we're gonna go through again. These are the attestations that we have for the application. And again, to provide the e-signature, I believe this is Dan E. Thomas. Sometimes with these accounts, I forget, but you see where it provides the e-signature down here. I believe it's Dan E. Thomas. We're going to sign and enroll. There we go. And this is a confirmation. congratulations, you've completed the Pennie enrollment process. Your enrollment will be sent to your insurance company. Further actions required. Please pay your premium by your coverage effective date to ensure that your policy is activated at this time. To pay immediately, please use the Pay Now button, okay? And you'll also receive information in the mail from your insurance company about the payment. This is a training environment, so we don't have the Pay Now button. So right there, we're just going to go to the dashboard and we are going to pick up with, oops, there we go. We're going to pick up with our next topic. Before we pick up with the next topic, I just want to make sure, does anybody have any questions? Does anybody have any questions related to dental insurance before we move on? Some things I'll be able to answer, some things, as you know, I'll have to work on. So,
Hi, this is Tia.
hey, Tia.
Question, are Medicare eligibles able to purchase dental only?
Medicare eligibles. That's a good question, Tia. I don't know. I'll get back to you.
Okay.
Same with Medicaid. I think we need to get back to you on that question, Jennifer. I saw that.
Yeah. Yep. I'm not exactly sure if they would be eligible. We'll check into it. We'll get back to you on it. We'll update you. Any other questions? Okay.
Yeah, there's a question in the chat here. If you're able to search dental providers.
Sure, absolutely. In fact, what we'll do is let me go back out here real quick. Oops, hold on a second. Let me get back to this account. What we will do is we'll actually take a look here. From here, we can go in. I'll put my zip code here, 17101. There we go. And okay. All right. From here, we're going to skip over. We're going to view plans. Okay. And in terms of, oops, sorry, let me go back. In terms of providers, let me see here. Just out of curiosity, does anybody know a doctor's name that they want to search for?
Nagel, Nagle, Harrisburg.
Robert Nagel, dentist?
Yep.
Awesome, Tia. Thank you so much. You have no idea. I actually go to Center City Dental down here in Harrisburg, but I didn't know Dr. Nagel. So, oh my goodness, he's on Pine Street too. There you go. All right. So once you have this selected, we can then go next. And again, this is where they ask about doctor visits. With the dentist, you might go 2 times a year for cleanings. We'll say that. In terms of monthly prescriptions, that's, unless there's something significant, we can, put that information in here. View plans, it shifts completely to dental. Okay. Do you see where it shifted completely to dental? When it does, it shifts to the dental insurances that Dr. Nagel and his office would be aligned with. So we can actually compare 3 plans right off the top if we want. There we go. So hopefully that answers the question. And seeing that there's 3 minutes left, perhaps we'll just talk about dental insurance for the next few minutes. In terms of the Medicare and Medicaid question, whether or not folks would be able to shop as an option, on Pennie for Medicare and Medicaid. We'll get an answer for you, an update through through our sister contacts on that. Were there any other questions related to dental insurance?
So Scott, this is Tia again.
Hey,
Just a
Tia.
question on the summary of benefits. Can
Mhm.
you go to the summary of benefits and show us where there may be or may not be a waiting period for services?
Mm.
So it really, just any adult plan summary of benefits.
Okay, well, let's see if we can find one. Okay. Here we go. Let's take a look at this Dominion real quick. Summary of benefits coverage. Okay, this is where it's going to take you outbound. Okay, and this is Dominion National Summary of Benefits, 11 pages is what they've got here. And the question specifically was about wait time to you?
Yeah, waiting period. Sometimes there's a waiting period for benefits. We've had folks who have had to wait an entire year to be on the plan and then select the same plan the next year in order to get the services.
Hmm.
So I know,
Scott, if you go to
Yeah.
page 3,
So I can kind of answer that. So that varies by carrier, and oftentimes that is they'll have that 1 year waiting period if they've never, or if they have a gap in dental insurance, or if they've never had dental insurance before. And if they, that's it varies by carrier. But
And I think I thank you very much, Katie. And I think I heard the echo of Jake Loughton, which is always appreciated, Jake. It says on this particular Dominion National that there are no annual maximum dollar limits, no waiting periods, and no deductibles. So I guess that's under the plan highlight. So.
Yep, and those can vary by plan as well.
Okay. All right. Excellent. Were there any other questions? Well, I appreciate everybody taking time to be with us today. And again, we recorded this session, so we'll be uh, we'll be making it available as a resource. We will continue the series with a discussion of income in the next couple weeks. But dental insurance is important. It's something that we need to be able to talk about. It's a critical component to healthy living. It's a vital component to overall health and well-being. So thank you again so much, everybody. If you need anything, we're here. Please don't hesitate to reach out. And with that being said, I hope that everyone has a peaceful day.